Are certain jobs bad for your gut? Understanding IBD risk in everyday work. Imagine your job affects not just your income, but your gut health. What if the work you do every day could increase your risk of a debilitating disease silent in millions? Today we explore inflammatory bowel disease, or IBD, and how certain occupations may elevate your risk. What is IBD? What causes it? Who's most at risk, and can your job really matter? Let's find out. What is IBD? Inflammatory bowel disease, commonly called IBD, is a chronic inflammation of the digestive tract. This inflammation can lead to pain, diarrhea, bleeding, and long-term complications. Two main forms are Crohn's disease and ulcerative colitis. Ulcerative colitis affects the colon and rectum, causing ulcers and bleeding. Crohn's disease can impact anywhere in the digestive tract, from the mouth to the anus. It leads to deeper inflammation than ulcerative colitis and may affect nutrient absorption. IBD isn't a short-lived infection. It is a lifelong condition. People often have flare-ups followed by periods of remission. Where symptoms calm down. Symptoms vary by person and disease type, but common signs include frequent diarrhea, abdominal pain and cramps, blood in stool, unplanned weight loss, fatigue and weakness, loss of appetite or nausea. Some people even experience symptoms outside the gut like joint pain, skin inflammation, or eye irritation. Symptoms may come and go, but long-term control is key. Meet Sarah. She's a 29-year-old nurse. She loves helping people. But for months, something wasn't right. She started having stomach cramps during night shifts. She thought it was stress, maybe hospital food, maybe just lack of sleep. But the cramps got worse. Then came diarrhea, then blood in the stool. She was caring for patients, while silently suffering herself. After tests, Sarah was diagnosed with ulcerative colitis, one type of inflammatory bowel disease. Her doctor asked about her routine. Rotating shifts, irregular meals, poor sleep. Studies suggest disrupted sleep cycles and chronic circadian rhythm changes, common in night shift workers, may increase inflammation in the body. Sarah didn't cause her disease, but her work schedule may have played a role. She adjusted her shifts, improved her sleep, started treatment, and slowly, she got her life back. Doctors don't fully understand exactly what causes IBD, but they do know it involves a mix of factors. 1. Immune system. Normally, your immune system protects you. In IBD, it mistakenly attacks the gut, causing inflammation. 2. Genetics. People with family members who have IBD have a higher chance of developing it too, showing a strong genetic component. 3. Environmental triggers. Your gut bacteria, the microbiome, may be influenced by diet, antibiotics, and other exposures early in life. 4. Not caused by stress or diet alone. While stress, food, and lifestyle can trigger flare-ups, they don't cause IBD, although they matter in symptom management. Risk factors include: some people are more likely to develop IBD than others. These are known risk factors. Age. Most new cases are diagnosed before 30, although it can occur at any age. Family history. If a close relative has IBD, risk is higher. Smoking increases risk of Crohn's disease and may worsen disease course. NSAID medicines. Drugs like ibuprofen can worsen symptoms. Lifestyle. Heavy alcohol, poor sleep, stress may influence flares. Diet and physical activity. Diet doesn't cause IBD, but ultra-processed foods may raise risk, while physical activity may be protective. A diesel mechanic came to my clinic who is 41-year-old diesel truck mechanic. He's been working around engines for 20 years. Every day, diesel fumes, metal dust, chemical solvents. He started experiencing fatigue and abdominal pain. He ignored it for months. "I'm just tired," he said. But after severe weight loss and chronic diarrhea, he was diagnosed with Crohn's disease. Some large international research reports, including coverage by Medscape, suggest possible higher IBD risk in occupations exposed to diesel exhaust and industrial pollutants. Does diesel directly cause Crohn's disease? We don't have definitive proof, but long-term exposure to air pollutants may influence immune function and gut inflammation. He now uses protective masks, improved ventilation, and follows treatment strictly. Awareness changed his life. How is IBD diagnosed? Doctors diagnose IBD using a combination of physical exam, blood tests, stool samples, endoscopic procedures like colonoscopy or sigmoidoscopy, imaging such as CT scans. These tests help not only confirm IBD, but also determine severity and which part of the gut is affected. Another patient who was 19-year-old had university exams. He was doing late-night studying and eating fast food when he started having diarrhea and abdominal pain. He blamed stress, but symptoms persisted for months. He became weak, lost weight, missed classes. Finally, after colonoscopy and tests, he was diagnosed with IBD. The biggest mistake is ignoring early warning signs. Early diagnosis prevents complications. Treatment. There's no cure yet for IBD, but many people live full lives with proper treatment. Common treatment options are anti-inflammatory medicines. These medicines reduce gut inflammation. Immunomodulators. These calm the immune attack. Biologics. Targeted therapies for moderate to severe disease. Nutrition and diet. Tailored diets can reduce symptoms during flares. Surgery is needed in some cases to remove damaged bowel. Treatment isn't one size fits all. It's personalized. Prevention and lifestyle. While you can't guarantee prevention, key lifestyle choices can reduce risk and help. Manage IBD. Stay physically active. Exercise may lower risk. Maintain healthy sleep. Poor sleep may worsen inflammation. Avoid smoking. It's a strong modifiable risk factor. Balanced diet. Avoid foods that trigger your symptoms. Occupations and IBD risk. Now here's the part that raised attention. Can your job affect your IBD risk? According to reports, a large international study suggests that certain occupations may be linked with higher IBD risk, possibly due to exposure. For example, to diesel fumes and work patterns like shift work. Other research highlights occupational exposure to chemicals or dusts in jobs like textile work, glass, ceramic, as having possible associations with increased hospitalizations for IBD in some countries. What do studies say? Some older research found that sedentary, indoor jobs like office work or sales may show higher rates of IBD, compared to manual outdoor work, possibly due to lower physical activity or lifestyle patterns. Jobs involving extended, irregular shifts. Artificial environments or disrupted sleep rhythms have been discussed as possible IBD risk influences, though evidence is still emerging. Important. Not all studies find a clear occupational trigger. Some analyses show no definitive link between occupation type and IBD onset. It remains an area of ongoing research. If you're experiencing symptoms like unexplained belly pain, diarrhea, or fatigue, don't ignore them. Early diagnosis and treatment make a world of difference. Like, comment, and subscribe for more health stories. Share this video with someone who works long hours or night shifts. It might just help them take their gut health seriously. Got questions about IBD or how your job might affect your health? Drop them in the comments below.